inspiring and bringing high-quality, affordable, and compassionate health care for everyone.
This is National Minority Health Month, and we are joined by Kim Beauregard, who's the president and the CEO of Intercommunity Healthcare, and Juan Laboy, who is the chief practice manager. Thank you both for being here.
Thank you for having us. It's great to see you both again.
We go back years,
We go
Kim.
back many years.
And I'm glad to know you. Now we're going to go back years.
Yes.
It's so awesome. Your daughter's good?
My daughter's well, thank you.
You're going to be a grandmother?
I'm going to be a grandmother, her first
okay,
baby.
We get all this personal stuff out of the way.
So
Congratulations.
everybody's well, but
good.
Thank you.
So, you know, when we talk about this month, we've talked so much in the news about access, and that's really what you guys are, is that it's really a way to support Minority Health Month, not just now, but all the time, because you need to make sure that every member of all the different communities is going to have access to health care.
Absolutely, absolutely. So Intercommunity Healthcare is a community health center. We have 21 sites. We're all in the greater Hartford area. We do everything from school-based health centers to primary care. We believe our line is, and we believe in this and live this, is healthcare for the whole person and the whole family. So we do primary care, physical health, behavioral health, and addiction services, and all of those go together. You know, even with all the violence that we're seeing every day in the world, there's so many components of it that we have to dig down to the root of it and really talk about all these things: the primary care, the medical, the behavior and addiction services.
Let's talk about the cost. There is no cost for a good portion of the people that are getting this.
For us, yes, we are considered a federally qualified health center and a local mental health authority for the state of Connecticut, and the federally qualified from the feds. So anyone can come to us. We have same-day access. Anyone can come to us. We do, if you have insurance, we go through your insurance.
Okay.
We work mostly with people who are on Medicaid, and we help people to get on Medicaid, get all the resources they need so they can get all those services that they need to live a healthy, quality life.
That is wonderful.
Yeah, so if people are listening, I mean, who do you really want to make sure, what do you want these families who might not be coming to get their care, what do you want them to know?
I think first and foremost, families to know that they can get mental health. A lot of people don't want to talk about mental health.
No,
and that's
still,
one of the
still
things.
a stigma. As much as we try to brush it under.
And just like we go to our dentist, we check our eyes, we have to check our head sometimes. And a lot of times we put it off to the side.
Yeah.
So know that you can go to their doctors and check out your mental health. A lot of times just talking to our community as well, and we have patients that we treat for addiction medicine, behavioral health services, and a lot of times they just want to talk to someone, find other things to take their mind off and to get treatment.
How do people get started? What do they do? Where do you go? What if they don't have the internet? What happens?
They walk in. They can walk into
any one of the 21 sites.
Well, basically we have the 3 community health centers, which is in East Hartford at 281 Main Street. We are in the north end of Hartford at 1614 Coventry Street, and we have an office also in South Windsor at 828 Sullivan Avenue.
Okay.
Our 10 school-based health centers, you have to go through the school system to get in there, but our numbers for children for mental health has doubled since September.
Yeah.
We have a
Since
mental
September.
Since September. So we do have a children's mental health crisis. We have an opioid crisis that we kind of didn't talk about during COVID, because again, we're just trying to keep people alive during COVID and get what they need, but it's still the same. The suicide rates have just gone up exponentially.
That is so sad.
And it's all tied together. So we just continue to say we need the funding to continue these services. They work.
Yeah.
We have many people who have gone through our services who are now our staff.
Yeah.
And people do recover.
Well, and let's talk about that, because Juan, part of the importance is a diverse workforce.
Absolutely. I am fortunate that we work in a very diverse population here in the community. So being a person, I'm Puerto Rican, and it's amazing. We treat a lot of
You're very handsome.
Hey, thank you
Isn't
so
he?
much. I appreciate it.
Just wanted to throw that out there.
So a lot of times, you know, we meet
You made him turn pink.
we meet people in the community, and they say, hey, you look like me, you talk like me, or can I speak to someone that speaks Spanish? And the first thing I say, yo hablo español. So it's
you're
great.
Spanish.
That's so awesome.
So it's great to talk to our community, and then you know, even talk about their health. When we talked about earlier, someone could walk in and for the first time haven't seen a provider for a long time. They could get provider services, therapeutic services right when they walk in. And education. It's hard to tell someone that's Hispanic that has rice as a staple, or you have to cut the rice. No, we will talk to you what other ways you can do it, what kind of rice to switch to, things like that to make sure they get healthy.
Yeah.
So having that diverse education, also employees as well. I think it's great.
We really, and it speaks to our name, intercommunity, right?
Yeah.
We're in the community. Our staff live and work in the community
Absolutely.
that we're providing services to, and that's what's so important. We're part of the community.
Well, you're both beautiful people, and we appreciate that.
Appreciate that.
And you can support these beautiful
Yeah.
people and this great organization
June
because
1st.
they've got a Fairways to Care golf tournament coming up. It's open to everyone June 1st at the Keeney Park Golf Course in Windsor. To give more, again, it's learn more. You visit give.classy.org/fairways to care. Give.classy.org. That's funny.
It's right there on your screen. Take a picture of it and then go to your computer.
And we'll also have it on if you go to our Great Day Connecticut website. So we'll make sure we have the
Kim,
links
do you
there
golf?
for you.
I'm not supposed to tell anyone that I don't.
That's okay. I don't either.
If,
I go to
if someone
lots of
wants to
golf-
teach me
Yeah,
before
well,
then,
I
it'd be
don't-
great.
oh,
Yeah.
you don't want me as a teacher.
I go to
trust me.
lots of golf tournaments and I don't golf. There's other things to do.
We'll be
you
there.
can
We'll both
socialize,
be
you can
there,
get
so-
sun, you can
Sorry,
eat,
good.
That's
have
right.
cocktails, have
Designated
fun.
driver of
Yeah, exactly. We look forward to seeing you there.
Yes.
Thanks for coming out.
Please join us.
Thanks
Thank you
for
so
coming on.
much for everything.
Yeah, good
pleasure.
luck. Great work that you guys do.
Appreciate everything.